Before starting aripiprazole, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. The extended-release injection of aripiprazole should only be used if you have already taken the medication by mouth without any serious side effects. Your healthcare professional will administer the injection into the buttock or upper arm muscle, usually once every month. Some doses may be given once every 6 weeks or once every 2 months. After the first injection, your doctor may instruct you to continue taking your antipsychotic medication by mouth for 2 to 3 weeks to help maintain the right level of medication in your body. The dosage of aripiprazole is based on your medical condition, response to treatment, and other medications you may be taking. It may take several weeks to get the full benefit of this medication, so it's important to use it regularly. Remember to mark the days on the calendar when you need to receive the medication. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of aripiprazole suspension, extended-release syringe may include dizziness, lightheadedness, drowsiness, tiredness, blurred vision, weight gain, shaking, tremors, and redness/pain/swelling at the injection site. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist. Dizziness and lightheadedness can increase the risk of falling, so it's important to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to inform your doctor right away if you experience any serious side effects, such as fainting, trouble swallowing, restlessness, especially in the legs, seizures, trouble controlling certain urges, such as gambling, sex, eating or shopping, or interrupted breathing during sleep. This medication may rarely cause your blood sugar to rise, which can lead to or worsen diabetes. It's important to tell your doctor right away if you experience symptoms of high blood sugar, such as increased thirst or urination. If you already have diabetes, you should check your blood sugar regularly as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. In some cases, this medication may rarely cause a condition known as tardive dyskinesia. It's important to inform your doctor right away if you develop any unusual uncontrolled movements, especially of the face, mouth, tongue, arms, or legs. In rare cases, this medication may cause a serious condition called neuroleptic malignant syndrome, NMS. It's important to seek medical help right away if you develop any of the following symptoms: fever, muscle cramps/stiffness/pain/tenderness/weakness, severe tiredness, severe confusion, sweating, fast/irregular heartbeat, dark urine, or signs of kidney problems, such as change in the amount of urine. It's also important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking aripiprazole, make sure to let your doctor or pharmacist know about any allergies you may have and any medical conditions you are experiencing. This includes problems with receiving injections, blood flow in the brain, blood clotting issues, diabetes, heart problems, nervous system problems, obesity, swallowing problems, breathing trouble during sleep, and low white blood cell count. Be aware that this medication may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana as they can intensify these effects. Also, be cautious when driving or operating machinery until you know how this medication affects you. Aripiprazole may also make you sweat less, increasing your risk of heat stroke. Avoid activities that may cause you to overheat and be sure to drink plenty of fluids when it's hot outside. If you are an older adult, you may be more sensitive to the side effects of this medication. This includes an increased risk of falling. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor. And finally, if you have been prescribed aripiprazole for a mental or mood condition, do not stop taking it unless directed by your doctor. If you have any concerns about taking this medication, be sure to talk with your healthcare provider. It's important to be aware of potential drug interactions with aripiprazole suspension, extended-release syringe. This means that it could change how your other medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. They need to know about all the medications, both prescription and non-prescription, as well as any herbal products you are using. This will help them to make sure that aripiprazole suspension, extended-release syringe is safe for you. One specific product that may interact with this drug is metoclopramide. Also, it's important to let your doctor or pharmacist know if you are taking any other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, including allergy or cough and cold products, because they may contain ingredients that cause drowsiness. If you have any questions about using these products safely, be sure to ask your pharmacist. If someone has taken too much aripiprazole suspension, extended-release syringe and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include a very fast heartbeat and loss of consciousness. It's crucial to act quickly in such situations to ensure the person receives the necessary medical care. Medical professionals may conduct lab and medical tests, such as blood sugar, weight, and cholesterol/triglyceride levels, while you are taking aripiprazole suspension, extended-release syringe. It is important to attend all medical and lab appointments and consult your doctor for more information. When taking aripiprazole suspension, extended-release syringe, it's crucial to stick to your dosing schedule and not miss any doses. If you do happen to miss a dose, be sure to consult with your doctor or pharmacist to create a new dosing schedule. Additionally, if it has been several weeks since your last injection, your doctor may instruct you to take aripiprazole by mouth for a period of time. Be sure to follow your doctor's instructions carefully to ensure the medication is effective. Remember, consistency is key when taking this medication. This medication is not available for home use. It is given in a hospital or clinic setting and should not be stored at home. This extended-release suspension is used to treat certain mental/mood disorders, such as bipolar disorder, schizophrenia, Tourette's disorder, and irritability associated with autistic disorder. It can help to decrease hallucinations, improve concentration, and help you to think more clearly and positively. This medication is given as an injection by a healthcare professional. The injection is usually given once every 4 weeks. It is important to receive each scheduled dose of this medication as directed. If you miss a dose, contact your doctor or pharmacist right away to establish a new dosing schedule. It is important to continue receiving this medication as prescribed even if you feel well. The optimal timing to take this medication will be determined by your healthcare professional based on your individual condition. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.